Okay, hello everybody, and welcome to this online interview hosted by Pride Cymru in partnership with NHS Wales and particularly with the Welsh Blood Service. We are thrilled to know that this interview will be used as part of their internal NHS Virtual Pride. My name is Lou Caulfield. I am a very proud patron of Pride Cymru. And joining me is wonderful Dave Appleby, our BSL interpreter. And we are here to facilitate, really, a conversation about the changes that have been made to the rules around blood donations in Wales. To guide us through and help us understand those changes, we are thrilled to welcome back Dr. Stuart Blackmore, who is an expert in the field of donor medicine and blood donation. Look at him now, throwing his head back. Stuart has already generously given his time to Pride Cymru and has been part of an individual interview hosted by Dan Walsh, one of our directors and trustees. But today we're changing the table slightly, and I have questions sent in by you, by the public, by our community, that I will be asking Stuart. And these come from people, our community, who previously have faced many restrictions when it comes to donating blood. So before I kick off with the questions, I would like to hand over to Stuart to properly introduce himself and also to perhaps, so that we're all singing from the same hymn sheet, give us a summary of what these changes actually are and what they mean for our community.
Right, well, thank you very much, Lou. As you said, my name is Stuart Blackmore. My title is a consultant in donor medicine, and I've worked for both NHS Blood and Transplant, and I've worked for the Welsh Blood Service for the last 3 years. In terms of a background summary of the changes, we need to go back to the early 1980s when the HIV pandemic broke. And initially, no one knew why a lot of gay men seemed to be getting horrible infections that were actually leading to them dying, terrible deaths. Eventually, the HIV virus was found as the cause of the condition, and AIDS was then diagnosed officially. It took a while to develop blood tests for effective screening. And as we all know, very sadly, it took a very long time to develop effective treatments. But as we all know, there are effective treatments, and people can live with HIV in a very healthy way and have a normal life expectancy now, thank goodness. So we have to go back then to the blood services, who were confronted with this evolving pandemic, and it became apparent that the virus was transmitted through blood. And at that time, there was no testing available for HIV. So what they did was they put a permanent exclusion on all risk groups, and that include anyone who had ever had sex, any man who had ever had sex with another man. And that was deemed to be safe, to try and protect the well-being of any potential recipient of any blood component. And that exclusion lasted until in 2011, the blood services were tasked with reviewing this to see if there was another way of, ensuring the safety of the blood supply, whilst trying to meet the growing call for a fairer blood selection policy. So with the improvements in testing and the decreasing window period, that's the period between someone being infected and the laboratory staff being able to actually pick up the infection, with that being decreased, the deferral period was reduced from a permanent exclusion to a 12-month exclusion. So if a man had had sex with a man in the last 12 months, they would be excluded from donation. If, however, they were leading a celibate life, then they could donate. But if you had, as is the case in many gay relationships, men who have sex with men that are in an exclusive relationship, they would still not be able to donate. So there was still a lot of unhappiness about this, and it was further reviewed in 2017, and the deferral period for men who have sex with men was reduced from the 12-month period to a 3-month deferral period. Shortly after that, in 2018, the government then approached the blood services once again and said, please, can this be reviewed because it's still discriminatory? And is there a completely different way that we could go about selecting donors who are in higher risk groups on an epidemiological basis? So that means these people belong to a population where HIV is higher than in other populations. But obviously, it was not individualized at all. So as I said, celibate gay men or gay men in long-term exclusive relationships were just lumped together in the higher risk group. So the FAIR study, or the FAIR steering group, was set up and was led by Dr. Sue Brailsford from Public Health England and NHS Blood and Transplant. And I represented Wales on the steering committee. And what we came up with was, instead of assessing lifestyle risk on a population basis, so membership of that population would automatically exclude you, that we tried to come up with a way of assessing individual risks. So the ideal was that anybody and everybody would be assessed using exactly the same criteria, regardless of gender, regardless of sexuality, regardless of history. So that was obviously much, much fairer. So FAIR came up with a proposal that we would do away with questions for men, specific questions for men around men who have sex with men, specific questions for women relating to women who have sex with men who have had sex with men. We would do away with those questions, and we would just ask questions around behaviors. And basically, these would be around behaviors that are linked to having a greater risk of acquiring blood-borne infections, okay? Which is obviously very important, because at the end of the day, we all do not wish for any recipient of a blood component to be put at increased risk of acquiring an infection. So whatever changes came about, we needed to ensure that they would be as safe as the blood supply currently is. Adopting this approach, however, would also mean that some people who were eligible to donate under the then guidance may no longer be eligible to donate if their behaviors, fell into the high risk group. So the questions that were formulated were around risk factors that put you in a high category for acquiring a blood-borne infection. So the questions are, if anyone's ever had syphilis, if anyone's ever had a sexually transmitted disease, especially gonorrhea, in the last 3 months, they would be deferred for 3 months from successful treatment of the condition. If people partake in chemsex, they would be deferred for 3 months from the last chemsex activity. So if chemsex is part of your regular lifestyle, you won't be able to donate until your lifestyle choices change. And then the one question is the new and multiple partner, sexual partner question, where everyone is asked, have you had a new or multiple sexual partners in the last 3 months? If the answer to that question is no, we just move on to the next question. However,
and each of those, that has the 3-month specification for each of these.
Yes. Okay. So if you answer yes to, someone's had a new or multiple sexual partners in the last 3 months, you are then asked if you've had anal sex. And if you've had anal sex, you will be deferred for 3 months from the start of the relationship with the individual with whom you're having anal sex. Okay, after 3 months, I've spoken about window periods briefly, and I will come back to that. But the reason it's important is that that is the period that is deemed safe for us to pick up an infection, from when the person was first infected. So the window period for the various bloodborne infections, so for hepatitis C virus is 4 days, so that's really very short. For HIV, it's about 9 days. But the problem one is hepatitis B, because that has a window period of 30 days. Okay, so we double it for safety, and then we added another 30 days just to be absolutely sure that if anyone was slow to make antibodies, which is what we look for, we would have enough time to pick it up. So from exposure to testing is a 3-month deferral period, potential exposure to testing. I hope that's clear.
No, I do. I just wanted to check, and now I can totally understand why, because obviously the opening up and which we'll talk about, to allow more of our community to be included, of course we still have to, as you have said, ensure that the blood supply is safe.
If I could just clarify a little bit around syphilis.
Of course.
Syphilis, basically, syphilis, as you know, is a sexually acquired infection that is very treatable. So we pick up people that have got syphilis and we refer them on for appropriate treatment. Once you've had an infection, however, your body always remembers that you've had the infection and has antibody memory, which we will pick up every time we test it. So even though if you've had syphilis and you've been successfully treated and your lifestyle is such that there's no other risk factors, we unfortunately will still not be able to accept you for donation, because on our testing, we will always test positive for antibodies. And it's a legal requirement that we have a negative test to be able to release the blood component, okay? So and that is why people who have ever had syphilis can't donate. But that applies to everybody, not just certain groups of people. And it's just a legal requirement that we need to have all of our screening negative before we're able to issue the component. So it would be unethical then to bleed someone who we know they've had syphilis if you can't use the blood in the way that that donor intends it to be used. So that's why people who have had syphilis, I'm afraid, are not eligible to donate under the current rules.
Thank you for making that so clear and for giving such a clear explanation.
No problem.
I think that was a brilliant summary, and I've learned a lot from it. So I think if you're okay, we'll start with the questions that have been sent in. The first question we have is, how can I find out about the changes that have just come in? Okay,
so the easiest way is to go on the Welsh Blood website, which is www.welsh-blood.org.uk. The website's available in English and Welsh. And on the first page, you will see a little box that says search this site. If you just type in the word FAIR, F-A-I-R, into that box, then your screen will come up where you can click on the relevant item for further information about FAIR. Another way to do it is for you just to Google NHS FAIR Steering Group, and you will get a number of websites that include the Welsh Blood Service website, but as well as NHS Blood and Transplants website, so you can read more widely around what the other blood services have done as well. I would just also add that in Wales, we have done away with another discriminatory question, and it's around people who have had partners from areas of the world where HIV is of a very high prevalence. There used to be a deferral for that, but the government on the safety of blood tissues and organs reviewed the evidence that was presented to them by the FAIR Steering Committee around this issue. And it's been decided that it is safe to get rid of that question as well. So the Welsh Blood Service has done away with that question, which is great because it opens our doors to more people as well. So that's how you can find out about the changes. And if you have any direct questions that you'd like to speak to someone about it, or our specialist nurses at the Welsh Blood Service would always be happy to answer any questions. And the number is 0800 252266.
Thank you so much. And I'm sure that not only will lots of little signs be coming up beneath us now, but also at the end of this, there will be a link and another reference to the numbers that Stuart has just kindly given to us. So the second question, is there an age limit to who can donate? Okay, well, the short answer is yes, but it's a sort of a staged approach. And once again, a lot of our criteria are prescribed in law. So anyone under the age of 17 can't donate blood, okay? It's legally required that we don't bleed anyone under the age of 17. Over the age of 17, you can donate. You can donate at a frequency of
we would advise every 16 weeks, but for men, it can be reduced to 12 weeks. Then you can donate all the way up until, well, you can become a first-time donor up until you've had your 66th birthday. If you haven't donated before, once you turn 66, I'm afraid the boat has sailed. It's too late. All right. So that is based on safety. If you've ever given us a donation before the age of 66, you will be able to donate after the age of 66. Okay. However, once you reach the age of 70, you need to have donated at least once in the previous 2 years.
I understand.
And so you need to have demonstrated your ability as a donor to sustain the rigors, if you like, although that's a bit too strong, of donating blood. Because obviously, when we in blood donation, we have a scale. We need to satisfy the needs of donors and not cause them any undue harm, whilst meeting the requirements of patients for demand. So we would hate to bleed someone at the age of 80 if they've never donated blood before and cause them significant harm. And that's why the rules are like they are for age.
Thank you. Thank you. Good question. Number 3, do I just turn up to a session, and how do I know where I can donate?
Okay, once again, no, the answer is, especially now in the COVID pandemic, we have an appointment only system. And that's for reasons of safety during the pandemic. So once again, the same number applies. Please just ring the number 0800 252266, and you can book yourself an appointment, but you can also book an appointment online. And I'm hoping that those details will be available as well.
We'll keep repeating them. I'm non-binary and use MX. Is this an option?
Certainly is. We use a computer system to record all of our donors' data on there. So if you choose the pronoun or, the title, MX, then certainly we can use that for you. Just to let people know as well that we've recently changed from just asking people whether they're male or female. We're slightly handcuffed really by the organization that manages our computer system, in that ideally I'd like to be able to record your assigned sex at birth as well as your gender identity. Yeah. We can only record one at the moment. So I've opted to record your assigned sex at birth, which we need to know for the way we manufacture our products, okay? Because certain products need special precautions if you belong to a certain assigned sex at birth. So you will be asked what your assigned sex at birth is when you register. You will also be asked to confirm your assigned sex at birth during the donation process, and that'll print out on a piece of paper, which will then inform our staff how best to manage you and your donation.
Thank you. Number 5, I think part of this was answered really in the wonderful summary that you gave us before we started the questions. Why did it take so long for the rules to change?
Well, I think everyone was so shocked by the HIV pandemic and everyone was so scared, really. And basically, we needed to ensure that our testing was as good as it possibly could be to ensure the safety of any recipient, to make it as safe as we possibly could before we considered changing the rule, okay? But I think a lot has changed in society. When I grew up, the male homosexual act was illegal in the country I grew up in. So, I think society has moved on hugely, generally. So I think society as a whole was ready to accept a change, okay? Part of the FAIR study, they did surveys with donors and with staff and with the general population about what they felt about this. And those surveys were quite favorable toward moving toward a change, a non-discriminatory way of assessing eligibility. So society was in the right place, and we had sort of the right people in the right place and around the right table to come up with a solution that was agreeable to the safety committee, SABTO, as I mentioned, the Government Committee on the Safety of Blood Tissue and Organs, to endorse the proposal, and then for the various governments to ratify the change. So it just was all the ducks were aligned. We were all in a row and everyone was saying the right things and coming up with the right messages. So I think it's taken so long because it's taken society so long to change and accept minority groups.
I would totally agree.
Yeah.
Number 6, as a straight trans woman who previously and currently is in a relationship with a man, can I now give blood?
Okay, well, as an individual, I don't mind if, we're not going to ask you about your transsexuality or your trans status. We're just interested in you as an individual, and you will be asked the same questions as everybody else. You don't need to declare that you're a trans woman on the session. You won't be asked if you are. You will just be asked those questions. Have you ever had syphilis? Have you had a sexually transmitted disease in the last 3 months? Do you partake in chemsex activities? If so, have it been in the last 3 months? And have you had new or multiple sexual partners in the last 3 months? If you have, do you have anal sex? In which case the appropriate deferral will apply. And our nurses have been very well trained in managing the consequences of those questions. So, being able to have little chats with people around, well, at the moment, it's going to be a no, I'm afraid, but if ever your situation changes or your behaviors change or your choices change, then do give us a try again.
Wonderful. It's good to know that there is something that I didn't doubt that there would be, but to explain the whys of not, and also to push the not this time, that it's not a definite, it's not an ever existing no.
Absolutely. And I think what's also very important is it's not a no to penalize the individual that's offering their time and their blood. Okay. It's not a no to penalize them at all. It's a no to ensure the safety of the blood supply. Because you must remember that we supply blood and blood products and components for people from cradle to grave. So, some of the most vulnerable in our society, which are the newborns and the newborns with problems, need top grade quality blood components, just like everybody else, but we need to make sure that they are as safe as they possibly can be. And that's why I think it's important that people understand it's just making it safe, really, as safe as we possibly can.
Thank you. Well, this links in it. If blood is always tested, quite a blunt question, what's the problem?
Okay, so we only test for 6 infectious conditions. Okay, there's many more infectious conditions that are blood transmissible, but the purpose of our donor screening, and we call it the SAR, which is our donor questionnaire, is the blood safety questionnaire. The biggest difference one can make to the safety of the blood supply is by the types of questions we ask people, because it screens out most of the risks. And that's why we rely entirely on people being absolutely honest when they answer the questionnaire, and not, register under a different name and then change the question because they were deferred last time. So people's behaviors and motivations to donate sometimes need a little bit of examination, but we rely entirely on people to be honest, because our first defense against the contamination of the blood supply is the donor questionnaire. Okay, so that's our first defense. Our second defense is the quality of the testing, which has improved hugely over the years. I've just found what our window periods are. At the moment, I don't think we're going to be able to reduce those window periods any further, but that is our second line of defense. So for the infections that we do not screen for, we rely on the donor questionnaire screening people out who are at risk of various other infections. So that is why. And the other thing that's important here to say is there's a misconception out there that we test everybody for everything. So we don't screen for cancer. Some people think we screen for cancer on the blood tests. We don't screen for cancer. We only test for certain infectious conditions which are transmissible through blood. And that's why our blood is always tested, but it's not tested for everything.
Thank you. Question 8, I'm on PrEP, have been for 6 months. Can I donate?
Okay, unfortunately you can't. And the reason for that is that PrEP, as we know, it contains anti-HIV medication, and the intention is to reduce the chances of that person contracting the HIV infection. However, that interferes with our test. So it will delay, first of all, it mixes up the way we can interpret the test results. So you get unclear results, which are difficult to interpret, and that obviously potentially has a knock-on to the safety of the blood supply. It may also delay seroconversion. So if someone is on PrEP and they are infected with HIV, because it's not 100% guarantee that you won't be infected, it may delay the things that we look for in the testing that we look at. It will delay it becoming positive, which means it then compromises the safety of the blood supply. So I'm aware, I'm no expert in this area. Boffins in this area are looking at it. I can't promise that it's going to be, within any time period that changes may or may not be made. But all I'm saying is that at the moment, if you are on PrEP, and that's absolutely fine, it's your own personal choice and decision to do that. And please do declare it on our donor questionnaire when you do come and donate, because it's important that we know about it. Because at the moment, we would not be able to accept you. Likewise, if anyone's on post-exposure prophylaxis, so after a needle stick injury or after, an assault of some sort, if you're on post-exposure prophylaxis, you also will be deferred from 3 months after discontinuing the prophylactic medication.
Thank you for explaining that so clearly. Another question. I came to the UK in 2017 from Ghana, where I had to hide my sexuality. I tried to donate before but couldn't. Why? And can I now?
Okay, so this is very similar to the straight trans woman question. The fact that you're gay doesn't matter. It's what you get up to. So it's your behaviors that you're assessed by. The one thing with people that come from areas of the world where there are infections, which we don't have in the UK, and I'm talking about malaria here, there are certain restrictions around that. So if you've just been back to Ghana on holiday, you will not be able to give blood for the first 4 months after returning to the UK. And after that period, you will be able to donate, but it's very important that you let our staff know on our questionnaire that you have traveled to a malarial area, because we need to do a special test to screen for malaria. And the reason for that is malaria is also transfusion transmissible. And if malaria is in a blood component that then gets into a recipient, it has very bad prognosis for the recipient, okay? Most recipients who get malaria through blood transfusion do not do very well at all. So that's why it's very important. So, and obviously
clear as well that is not discrimination. It's not a discrimination against sexuality. That is a steadfast ruling, understandably, for anybody who.
Anybody, yeah. So it's anyone from anyone anywhere in the world where that's affected by malaria. If you travel there on holiday, or if you're born there, you will need to have extra tests for malaria. But just don't attend within 4 months of returning from a malarial area to give blood, because you will be deferred. And the reason for that is, once again, all to do with window period. Okay, we need to have a window period so that we make sure we have as great a chance as possible of picking up evidence of an infection.
Thank you. You've already mentioned this, but I will say it because valid question. Do I need to tell you that I'm gay, bi, or trans?
No, the simple answer is no, you don't. But you will be required, like everybody else, to answer the questions on the SAR that we've already run through. Yeah.
Thank you. Just 2 more questions. The penultimate being, I know as a gay man I could donate organs, but not blood. Why?
Okay. This is just to do with volume. Okay, so there are fewer organ transplants done in any 1 year than there are blood donations required. So, and for organ donation, the ability to do an individual risk assessment is far greater. So you will have a named donor whose medical records are very heavily scrutinized, and a named recipient. So you can match risk, and you can do an individual risk and knowingly have a conversation with the recipient saying, well, this is the only liver or heart or something that's available. but that donor had this particular condition or that particular condition, you happen to have the same condition, would you accept an organ from that donor? So that's what an individual risk assessment, whereas blood donation is not like that at all. Blood donation is anonymous. We have a responsibility to be able to trace a blood donation from vein to vein, but it's in an anonymous way. So, you cannot dictate who you wish to receive blood from because it's done anonymously. And for that reason, it's impossible to do an individual risk assessment on every donor for the particular recipient. But obviously, our questioning has now moved to a more individual assessment based on risk of behaviors within the donor. Yeah.
Thank you. And finally, I'm in a long-term polyamorous same-sex relationship. Can we give blood?
Okay. The same questions apply. Okay. So if you've had, the main question here is if the new and multiple sex partners. So if you've had a new partner or multiple partners in the last 3 months, you will be asked around questions, have you had anal sex in the last 3 months? And if you have, you will be deferred. So if it is a recurrent feature of your lifestyle that you're having anal sex regularly with new partners, you will be deferred until such time as that changes, until that particular behavior changes. But obviously that's seen in the context being asked about chemsex as well and other STDs. So just the fact that you're in a polyamorous relationship will not necessarily defer you from donation. It depends what you get up to, okay, and what behaviors you have within your polyamorous relationship. So there's no discrimination against the relationship, but there are safety issues that we need to factor in. Yeah.
Well, Stuart, I could happily stay talking to you all day, but I would like to, again, thank you. Thank you for generously donating your time. I would love to thank Dave. Thank you, Dave, for being wonderful as ever. I would like to give a personal thank you to Kath Harrison, who is the charity manager at Pride Cymru, who has made this conversation properly. She is behind the scenes. She is the one pressing record, and she is the one who has brought us all together. A huge thank you also to all of you who sent in our questions. And finally, to our partnership with NHS Wales and the Welsh Blood Service. I have learned a lot today, and I hope that this video will be spread far and wide to help our community understand the changes, the wonderful changes really that have taken place, that do lift many of the restrictions when it comes to our LGBT plus community, when it comes to donating blood. Stuart, thank you again.
My pleasure.
No doubt we will speak to you soon, and thank you to everybody who has watched. Bye-bye.